Hi, my name's Emily Fisher. I'm a third-year medical student and MPH student at UT Health. Today I'm going to be talking about my poster presentation for SPH Research Day. The title is Post-Concussive and Post-Traumatic Stress Symptoms Occur Together Following Pediatric Injury. So let's start out by talking about the two types of pediatric injury that we'll be discussing with this research. The first is traumatic brain injury in children. So the CDC defines this as a blow, bump, or jolt to the head or a penetrating head injury that disrupts normal function of the brain. It's estimated that over 470,000 children each year visit the ER for treatment of a TBI-related injury in the United States. Additionally, about 800,000 children are presenting to outpatient care for a TBI in the U.S. per year. So what this tells us is that traumatic brain injury is a significant contributor to morbidity and mortality among children. So following the acute period after a TBI, a significant amount of children will experience two persistent sequelae following a TBI. One of those is post-concussive symptoms, and the other is post-traumatic stress symptoms that you might have guessed. These can last for months to years following an injury, making it really difficult to return to normal functioning of the child prior to the injury. So PCS is further subscored into somatic, cognitive, emotional, and fatigue symptoms. Generally, this can include things like headache, sleep disturbances, dizziness, trouble with memory, attention and concentration, irritability, depression, and anxiety. Post-traumatic stress symptoms are further grouped into re-experiencing the traumatic event, active avoidance of the trauma, emotional numbing, and hyperarousal. This includes things like flashbacks, frightening thoughts, avoiding the trauma-related thoughts, places, and objects, a loss of interest in activities and feeling distant from others, also feeling easily startled or tense or on edge. So with all that information in mind, our aim for this study was to see if post-concussive and post-traumatic stress symptoms were occurring together in the same children following an injury. Children ages 8 to 15 were recruited for the study after sustaining an injury due to a vehicular accident. Children were determined by medical personnel at Children's Memorial Hermann Hospital in Houston, Texas, Level 1 Pediatric Trauma Center, to have sustained either a TBI or an EI. An EI is an extracranial injury, such as a broken bone, without any signs of head trauma or TBI. TBI was further broken down into mild, complicated mild, moderate, and severe categories based on the Glasgow Coma Scale and acute radiographic findings. Complicated mild means children who sustained a mild TBI plus findings of an intracranial bleed on imaging. These children in the complicated mild group were combined with the moderate TBI based on previous research indicating similar recovery trajectories. So 533 children were screened, 220 were eligible, and 129 participated in our data collection 7 weeks after injury. At the 7-week mark, children completed validated self-measures to evaluate for persistent PCS and PTSS. The post-concussive symptom inventory was used to evaluate for PCS. This measure has two forms based on the child's age. Therefore, as you can see on the table, our data is broken up based on the age of the child. So ages 8 to 11 is the younger cohort, and ages 12 to 15 as the older cohort. At this time, children also filled out the Child PTSD Symptom Scale to evaluate for PTSS. Spearman bivariate correlations were then conducted to evaluate the relationship between post-injury self-reported symptoms among PCS and PTSS. So now let's move over to our main table. As we can see, there are many correlations between post-concussive and post-traumatic stress symptoms in our subjects. The total PCS and PTSS scores were significantly correlated for both the total TBI sample and the EI group at both age ranges. For children in the younger group, the PCS and PTSS subscores, so those subdomains we were talking about earlier for both of those sequelae, were correlated. So that was a lot of data. I'll try to go over what all of this means and what we do about it. So a major takeaway is that these two sequelae, post-concussive symptoms and post-traumatic stress symptoms, may not exist as these discrete symptom profiles as they're usually designated, but rather they demonstrate significant overlap. What this means is that the subjects who endorsed higher post-concussive symptoms also had higher post-traumatic stress symptoms after these types of injuries. This has ramifications about how we medically and psychologically care for these children. Additionally, the extracranial injury group, those who didn't sustain a TBI under similar injury circumstances, also had significant correlation among the profiles. This caused them to question the specificity of this post-concussive symptom domain and whether it exists solely for those with a TBI. Research about the overlap among PCS and PTSS in children is scarce. However, our findings do correlate with a study done back in 2010 that noted correlation between these two symptom profiles among children with mild TBI and EI. Our study differently includes TBI of all types of severity. So our research supports the notion that we must further explore this intercorrelation between these symptom profiles of post-concussive and post-traumatic stress symptoms to inform long-term pediatric care. Thank you for listening. I hope everyone is staying healthy and safe.